So I will continue with the intraoperative care. Okay. Okay, so is it visible?
Yes, ma'am.
Yes, ma'am.
Okay, what is intraoperative? It is the period when intraoperative is, please respond. Intraoperative, it is a period during which time?
Surgery time.
Yes, but during the surgery time. Okay, so the period which is involved during the time when we shift the client. Like I've said, if you remember, preoperative is till you shift your client to the operation room or to operation theater. So once the client is shifted to that operation table, and till the client it is shift, okay, to the recovery room, so that hour is called, that period is called as a intraoperative phase. Okay, so it is a period from the time the client is shifted to the operating table and post anesthesia care unit or recovery room, okay, or the recovery unit. So this post anesthesia care unit is also same as recovery room, where we keep the patient or the client after the operation. Okay, so we keep them there for a few, okay, few days, we usually for 1 2 days, just for observation. If any complication occurs later, so we can manage the patient on time. Okay, because especially if you do any major major surgery like heart surgery and all, that is very high risk for the patient. Okay, so many complications might occur after the operation. So we usually, and this recovery room actually, it is always located near the operation room. So just next to the operation room we have this a recovery room, we always keep it near. Okay, and so that is called as the intraoperative phase. So you will see actually in the intraoperative phase we have so many surgical team, we used to say. So a surgical team usually consists of the surgeon who will perform the surgery. Okay, then we also have this one anesthetist. So an anesthetist, it is that he will be a doctor only, he will be giving the anesthetic agent. So this anesthetic agent is important. Okay, it helps in producing loss of sensation or even loss of consciousness. Okay, so because we cannot operate the patient without any anesthetic. Okay, so we have to give that to the client. So for that we have an anesthesiologist, we also used to see, we used to call. Then we also have a circulatory nurse. Okay, she will be the one who will be, so the scrub nurse and the circulatory nurse we usually have. So what is a scrub nurse? So the scrub nurse, if you can see even from the figure itself, so she will be the one who will be assisting the doctor or the surgeon. So she will be giving all whatever instrument it is required by the surgeon. So she will be the one who will distribute, she will give the all the instruments or articles required during the surgery period. Okay, and the circulatory nurse also, she will be there in the operating room, and she will be the one who will make sure, okay, if any other article is needed, she will help. And she will also maintain the documentation if needed, and she will also be the one who will, any information that needs to be informed to the family members or anything during the operation hours, so that will be done by the circulatory nurse. Okay, she will see the cleanliness of the operating room and all. Okay, so as you can see, this is actually a simple setup of a surgical or operation room. Okay, so we have this operating lamp. So this actually, it helps in proper visualization. Okay, so there will be so many lights will be there in this operating lamp. Okay, so it helps, okay, for clear vision. Okay, clear lighting is very important. Okay, so during operation hours, then we have, sometimes also depends, we also have the chief surgeon. So a chief surgeon, he will be the one who will be doing the major operation part, and the assistant surgeon, he will be the one who will assist the chief surgeon. Okay, then also in operation room we have the suction machine. Okay, then we have this instrument tables. In this instrument table, all is sterile. Sterile means we have to make sure everything should be free from infection. Okay, so because we, whenever we perform any open surgery of any part of our body, so it is a very risky, because if you don't maintain, if you don't keep everything clean, you might the patient or the client, he might get in any some form of infection and all. So we always have to keep everything clean. Okay, everything should be sterile or everything should be very clean. Okay, So we also have a monitor where we'll visualize what is the status of the client. In the monitor, usually it will show what is the pulse, what is the respiration of the client, what is his ECG status says. So those are also very important. Okay. So we have a monitor, then we have an anesthesiologist. So he will be the one who will inject that anesthetic agent or solution. Okay. And also that is the operating table and instrument table. So this is actually how operation setup is usually, okay, and how it is usually prepared. It is in this way. So let's see what are the different roles of the surgical team. Okay, so like I've said, we have main one, we have the surgeon, then we have the anesthesiologist or the anesthetist, then we have the circulatory nurse and the scrub nurse. So these are the four main important part of the surgical team. And other than these, we also have the OT technician, okay, which will help with maintaining of the lighting, maintaining of all the monitors and all. So we need an OT technician, okay, or operation, this one, theater technician. Okay, so the surgeon, actually he will be the one, when we say who are the surgeon, so he is the one who is responsible for determining the pre-operative diagnosis. Okay, also what are the choice and execution of the surgical procedure, explanation of the risks and benefits, and the post-operative management to the patient. So everything, mostly the main thing, it is mainly done by the surgeon. So he will be the one doing the operation. Okay, and it is also the responsibility of the surgeon to inform the client as well as to the family members. So whenever he plan to do any form of surgery, so he will be the one who will explain to the patient as well as to the family members what type of surgery he will do. Okay, then what are the outcomes of the surgery. Okay, if there is any complication, that also needs to be explained before. Okay, and even during the operation room time also, he will be the one doing most of the operation. Okay, and apart from surgeon also, we also have the assistant surgeon. So the assistant surgeon, mostly he will be just assisting the surgeon. Okay, but the main work will be done by the chief surgeon. Then the next is the anesthesiologist. Okay, so this what happened, he will be the one anesthetizing the patient. Okay, providing appropriate levels of pain relief. Okay, monitoring the patient's psychological status, as well as providing the best operative conditions for the surgeons. Okay, so we have also different types of anesthesia. Okay, some we give it only locally, some we give it as general, some we give it as regional. Okay, so those we will see later. Okay, but just remember, an anesthesia means it is that solution which is given to the individual, which will cause loss of sensation, so that the patient will not feel, and so that he will not feel the pain. Okay, so we have to give this anesthesia. And the next team is called as a scrub nurse. Okay, so the scrub nurse, what is she usually do? So for the first, if you can see even from the figure I have shown, so she will be the one preparing whatever instrument or whatever articles which is needed by the surgeon for during the surgery process. So that will be prepared by the scrub nurse. Okay, and she will also prepare a sterile field. So that whatever you have seen, okay, this instrument table, this is considered as a sterile field. Okay, so nothing should be touch. Okay, so whenever all this, whenever, before, we have to make sure that we have to maintain everything, all of this needs to be keep clean, and we should not touch anywhere near the sterile field without wearing a glove, sterile gloves. So all needs to be maintained very clean. Okay, because all this instrument and all will be using inside the patient's body, and also to prevent from any infection and all, we have to maintain the cleanliness or the sterility, we used to say. Okay, so the scrub nurse also, she will make sure she will maintain the patient's safety. Okay, provision of essential sterile articles and instruments, as you can see during, even in the figure, she will be the one distributing or giving the all the articles and equipments to the surgeon. Okay, then preparing the sutures actually we usually need during the whenever we open. Okay, whenever we cut or open any part of the body. Okay, so after that we need to close it, so we usually use sutures. Okay, so with the help of the sutures we will stitch it, then assisting the surgeon during the operation. Okay, so these are what are the things that the scrub nurse will do. Okay, so the next is the circulatory nurse or the circulating nurse, we used to say. Okay, so this what she will do, she will assist with the cleanliness. Okay, then create a safe environment for the patient. Okay, and as well as for everyone. So she will manage the activities outside the sterile field. As you can see, she is not involving directly in the sterile field. So the scrub nurse, she is the one who is wearing the gown. Okay, she is also uh, she is also the one handling all the sterile field. Okay, so the circulatory nurse, she is not directly dealing there. So she will be outside of sterile field, and also she will also provide nursing care to the patient in between. Then documentation also will be done by the circulatory nurse. Okay, whatever care given to the patient during that intraoperative period, that will be done by her. Ensuring surgical specimens are identified. Okay, suppose if anything needs to be taken from the patient for any form of investigation. Suppose if you are doing some form of open surgery of the intestine, and if you need to take any sample for investigation, so that type also we have to make sure that whatever samples that it is taken, it should be keep in a specific specimens, so to preserve the specimen, or to preserve that particular surgical specimen that has been taken. Okay, so she have to make sure all those, it is kept in the correct container or everything. Okay, so that will be done by the circulatory nurse. Then the in charge of the instruments, and after the operation is done, so she will be the one counting all the instruments, whatever instrument it is there. So all should be, after the operation, that exact amount of instruments should be there. This is very important because it has been so many cases has been there where sometime what happened, because of some neglect. Okay, so what happens, some instruments, they are left inside the patient's stomach or patient's organ, they are left inside the patient's body. Okay, and after, only after the patient, what happened, after the operation, they used to complain of pain and all those, and after that, when they do the operation, this one ultrasound or x-ray, it has been found that some instruments are being left inside the patient's body. So we have to be very careful. So that is the main reason we have to always count. Okay, after the operation, this circulatory nurse, she will count whatever articles or instruments it is used during that particular surgery part process. So all those we have to count. Okay, that is very important. That is the main reason. Okay, so communicating also any relevant information, if we have to anything, it's there to inform the patient family. Okay, if in between, suppose in between a surgery, if anything happened to the patient, or any unstable condition happened to the patient, so that also we need to inform the family members prior only. Okay, so that also we have to will be done by the circulatory nurse. Okay, so these are actually what are the main surgical team. We have the surgeon, okay, the anesthesiologist, or the anesthetist, then we have the scrub nurse and the circulatory nurse. Okay, so now we will see, just briefly I will tell you about what do you mean by anesthesia. Okay, since I have already said, okay, so many times I think I have mentioned anesthesia. So actually, when we say anesthesia, it is an artificially induced state of partial or total loss of sensation. Partial, when we say, it is only, suppose if you remember, if you have done, if you have gone for any tooth extraction, do you have you gone for any tooth extraction and all, why they used to remove the tooth? Okay, yes or no? I think you
Yes,
have
ma'am.
must have gone. Yes or no? They used to inject something, yes or no, inside the particular part of
Yes,
the
ma'am.
teeth, and after that you feel numb. You don't feel anything there, right? So that is actually what it is called as the anesthesia. So when we give this solution inside that particular part of the body, okay, it becomes numb. So in order to help the patient to relieve the pain, or to so that they will not feel the pain when you do the operation, so we usually give this anesthesia for that purpose. Okay, so it can be partial also, or it can be total loss of sensation. Okay, so, and it occurs with or without consciousness. Suppose, for example, is if you do an operation of the teeth, okay, of a tooth. So for that type of operation, they will give you only anesthesia will be given only on that particular area, and the person is also conscious, she is not unconscious. Okay, and if suppose if you need to do operation of the heart, okay, heart surgery, so for that we need to give a general anesthesia, which is see, whenever we say general anesthesia, in that cases the persons will have loss of consciousness. Okay, that means he will not be aware of anything, totally he will be shut down. Okay, so that is the main things when we say anesthesia. So it helps in it partial or total loss of sensation, and it can be with or without loss of consciousness. Okay, so what happens whenever we give any anesthesia to any patient, it blocks the transmission of the nerve impulse. So when you block the nerve impulse transmission, that means the patient, he will not have the feeling or the pain sensation, he will be unconscious. Okay, and also he would suppress all the reflex, so everything will be relaxed. Okay, so that if, because if this are not done, then the patient might So many things, complication might occur. So all the reflexes also will be suppressed. Okay, like suppose gag reflex, okay, swallowing reflex. Okay, so all this also will be relaxed or suppressed, and it also helps in relaxation of the muscles. That is the main reason also why I have also mentioned about the aspiration. Okay, so because during that is why we have to always keep the patient nil paw orally. That is the main reason, because everything our muscles get relaxed, and because of that some food also might enters inside the this one lungs and all. So in order to avoid that, we always have to keep the patient nil per orally. Okay. Then control level of consciousness. Okay. So we can, depending on the type of surgery to be done, we have to plan. Okay, whether he will go for uh, general anesthesia, or whether he will go for local, or whether he will go for regional. So this also depends. Okay. So whenever we say anesthesia, usually we have three types. Okay, we have the general anesthesia, then the local and the regional. So whenever we say general, this is actually used whenever you are planning to do any major type of surgery, like I've said. For example, your open heart surgery or kidney transplant or appendectomy. So like all those type of surgery, okay, we will use where we need to paralyze the patient, or we need to make the patient okay, where we will keep the patient unconscious. Okay, so in those type of condition we will give this general anesthesia. Okay, and a general anesthetic acts by blocking the awareness center in the brain, so that the patient will have amnesia. Whenever we see amnesia, that means loss of memory. So a patient who are given this general anesthesia, what happen usually, they don't remember anything about the surgery. Okay, so entirely they will be not aware of what is done during that surgery process. Then analgesic, that means they will not feel any pain. Okay, then hypnosis, that means they will be in a sound sleep. Okay, artificial sleep we used to say that. Then also relaxations, everything will be relaxed, all the muscles. Okay, even the everything will be relaxed during this time. So whenever we give a general anesthesia, so these are the things which usually occurs. Okay, so the person will have loss of memory or an amnesia. He will also have analgesic type of effect, that means he will not feel any pain how much you cut. Okay, because especially when we do heart surgery and all, these are very major type, right? So if the patient will not feel any pain, then he will be in a very deep sleep. Okay, and also everything will be relaxed. Okay, then the surgeons usually use it when they operated on internal organs and for other invasive time consuming procedures. Okay, for example, your open heart surgery, brain surgery, organ transplantation. So in all these type of major surgeries, we usually do give the person this general anesthesia. Okay, the next type of anesthesia is called as a local. So whenever we say local, actually you will be injecting the solution only on a particular part of the body. Suppose if you have some wound or cut injury in your hand, okay, and for that what happened, you need to do the stitching. So for doing the stitching also they used to give this local anesthesia. So they will inject the solution only on your particular part of the hand that is having the injury or that needs to be stitched. Okay, that is called as a local anesthesia. Okay, and this local anesthesia also similarly also it acts in the same way. It briefly disrupts the nerve transmission. So when it disrupts the nerve transmission, what happened? You will not be feeling the pain in that particular area. So everything becomes numb. Okay. So and also these are also mostly done in the use in the dentistry, like I've already informed from before. So especially if you go for any tooth extraction, okay. So they used to give this local anesthesia. So in that particular tooth that need to be extracted, they will inject this, and after it is injected, you will not be feeling the pain. Okay, so they will remove the tooth. And if any form of mole or if any warts is there, okay, in the body part that needs to be removed, so they will use this local anesthesia. Okay, so it is injection of a solution containing the anesthetic into the tissue, okay, at the planned incision site, or also we can apply it. Sometimes what happen, we also have some application cream type or gel type where we apply it. Okay, so this also it acts as a local anesthesia. Okay, so this gel type actually, for example, if you want to insert some nasogastric tube, actually this nasogastric tube, it is that tube where we give to the client who is not able to take orally, okay, by mouth. So we'll insert this tube from the nose into the stomach, so everything that whatever the patient eats, it will go directly uh, it will go directly into the stomach. So in that time also what happened, in order to insert that, we usually use this topical anesthetic agent. Whenever we say topical, that means it will be applied, okay? And when it will apply it on that tube, so by giving this, what happened, we are relieving the pain, because while inserting it, the patient might have pain, okay? Because we are inserting something foreign substance right inside our body, so the patient will feel the pain. So in order to avoid that, we use this topical local anesthesia. Okay, so remember, anesthesia also we have two type. We have the topical anesthesia, that means it will be like a cream type where you will apply it directly on the skin. And the other thing is the in solution. The solution means with the help of the injection, we will inject it in that particular part. Okay, so this is about the local anesthesia. Then we say regional. So this regional actually, it is a temporarily interrupts the transmission of sensory nerve impulse from a specific area or region. So it will be done on a particular region, not a particular body part, but it is on a particular region. Okay. Then the motor function may or may not be affected, and the client does not lose consciousness. Okay, even in local also, obviously he will not have any loss of consciousness, and even in regional also, the patient will not be unconscious. So everything he will be aware of, everything that is going on, just that he will not feel the pain. Okay, and for example is hand and joint surgeries. And if this then during cesarean section delivery, that means whenever the baby is born, okay, via the surgery, so we usually give this spinal anesthesia. Okay, spinal anesthesia is also a type of regional anesthesia. So this is actually how we usually give. Okay, so when we give this, whenever we give this spinal anesthesia, what happened? So from the hip till the, okay, from the hip below, okay, the mother, she will not feel any pain. Okay, she will have loss of sensation over those area. Why it is needed? Because what happens, so they will need to cut, okay, they need to cut the abdomen, okay, to take out the baby, okay, during the delivery. So for that purpose, they give this spinal anesthesia, so she will not feel the pain from the hip below. Okay, so this is actually a simple diagram how it is, what are the three main types of anesthesia. If you see, in general, it has a loss of sensation throughout the entire body we have. And not only that, but the person will also have loss of consciousness. Okay. And if you see regional, that means like I've already shown the example of spinal anesthesia. Okay. So whenever we give that, the person will have a loss of sensation in the particular region of the body. Okay, usually when we give spinal, the person will have loss of sensation in the lower part of the body. Okay, and local anesthesia is, for example, if you have it will have loss of sensation only a particular part of the body. Okay, so for example, I have already said about if you have any tooth extraction or any injury in the hand that needs to be stitched or anything. So these are the three main types of anesthesia. Okay, general, regional, and local. So with this diagram, so you'll be more clear what is the main meaning of types of anesthesia. Okay. So next we'll see what are the role of a nurse. Okay, as a nurse during the intraoperative phase, what we have to do. So first of all, we have to teach the client as well as the family. Okay, then we have to provide support and reassurance to the patient. Okay, so because obviously the patient will be in the operation theater room, so he will have lots of anxiety, fear, and all. Okay, so we have to provide support and reassurance. Okay, control of the environment, so this will be mostly done by the circulatory nurse. Okay, she will make sure everything, the temperature should be okay, uh, this one comfortable, okay, temperature, humidity, cleanliness, proper lighting, all those will be done during those time. Provision of resources, like if you say resources means it come, what comes here is the light resources, water resources, so all the articles which is needed for the operation. Okay, so all those should be available in the operating room. Okay, maintenance of asepsis. Okay, actually whenever we say sepsis, it indicates infection, and when we say asepsis, that means it is free from infection. Okay, so we have to make sure, like I've said, since we are cutting a part of the body and we are opening up a part of the body, so we have to keep everything clean. So we have to make sure everything it's sterile or clean. Okay, the next is monitoring of the physiological and psychological status is very important. Physiological status, how you'll monitor. So with the help of the cardiac monitor, we will monitor the vital signs. Okay, then all those will comes under the physiological. Then also she will do the documentation. Okay, informing the clients and the family. Then patient positioning. Okay, actually as you can see, in the diagram, those are the various positions where a patient is being kept during the surgery time. Okay, so it can be a supine position. So the supine position, the patient will directly lay on their back. Okay, then prone position, it is just the opposite of supine position. Then lateral position or side. Okay, then lithotomy is usually done for delivery and all. Okay, so depending on the type of surgery to be done, so it is the role of or the job of a nurse to make the patient to keep the patient in that particular position according to the surgery. Okay, so assisting the surgeon during the operations procedure, she will, like I've already shown, so she will give all the articles, instruments, okay, all those. And even after the procedure, the nurse, it is the job of the nurse to also count. Okay, she should do the head count of all the articles that has been used. Okay, then she have to, it is the nurse only, she will especially the circulatory nurse, she will alert for any breaks and all. Okay, so this is actually about the intraoperative phase. Okay, are you clear with the intraoperative phase? Yes or no?
Yes, ma'am.
Yes.
Yes,
Yes,
ma'am.
ma'am.
Okay, so anesthesia, I'm just giving you the types. Okay, actually anesthesia also we have some stages. So since you'll be learning all those again in your second year, because even if I told you, even if I uh, teach you now, you will not be able to understand that much. Okay, so it's okay. When you'll be in your second year, you'll be learning about the various stage. Okay, especially for the general anesthesia. Okay, for general anesthesia we have some stages how a person. Okay, so this is about the intraoperative care. Okay, so related to the nursing diagnosis, are you all, your ma'am, you know about nursing diagnosis? Yes or no? Yes or no?
Yes, ma'am.
Okay, so actually, these are some of the nursing diagnoses which we can prepare for a patient or we can plan. Okay, if a person is have during the intraoperative period. Okay, or even in the pre-op. Okay, so the same nursing diagnosis we can apply. The first is like a knowledge deficit. Okay, whatever we say related to, that means what is the cause. Okay, why the patient is having knowledge deficit related to what? Maybe he don't know that much related to the surgery. Okay, so that is why we have the nursing diagnosis as knowledge deficit related to the surgical procedure. Then anxiety related to lack of knowledge about a surgical procedure. Because of that also he will have the anxiety. Fear related to the risk of death, because obviously if the person go for surgery, okay, so he will have that fear. Okay, what will happen to me in between the surgery, whether I will be able to survive or not, especially if you're going for major surgery and all. Okay, so we'll have all that fear. Then disturbed sleep pattern. Okay, so disturbed sleep pattern, that means the patient will not be able to have a sound sleep. Okay, or insomnia. So why we have that? Because of maybe of hospital routine, which might be different from his usual routine at home, or psychologically he's very stressed. So because of that, he will not be able to sleep. Okay. Risk for fluid volume deficit, because what happened during the operation, so lots of blood will be lost. Okay. So because of that, also the patient will have this risk for fluid volume deficit. Okay. Then anticipatory grieving. Anticipatory is like especially if you're because if a person, if any part of the body is need to be removed or need to be cut or need to be amputated, so that time what happened, it will be really very, person will be at a very, he will be very sad, or he will have lots of, because obviously if you lost your body part also you will feel sad, right? So that is called as anticipatory grieving. Okay, related to any perceived loss of the body part associated with the planned surgery. So these are some of the nursing diagnoses. Okay, so these I have just given just for briefly only, just okay for your knowledge. So these are some of the nursing diagnoses usually which we can prepare for a client who are in the pre and intraoperative care, okay, or intraoperative phase. So I hope everyone is clear with this one, intraoperative. Okay, so you have to remember who are the team involved. Okay, so as I said, we have four. Okay, we have this surgeon, anesthesiologist, scrub nurse, and a circulatory nurse. Okay, so apart from that, also we have also the OT technician and all. But these are the main people involved. Okay, in the surgery room or the OT room. Okay, so no question. Are you all clear?
Yes, ma'am.
Okay.
Yes,
Okay then.
ma'am.
Yes,
Okay
ma'am.
then. Thank you, everyone. I will stop now. Okay.
Thank you, ma'am. Thank you,
Thank you,
ma'am.
ma'am.
Thank you, ma'am.
Thank you, ma'am.